Welcome to the Medical Center Show. I'm Joe Scott, the President and CEO of Jersey City Medical Center. And today we have a very special guest with us, Dr. Richard Yoon, who is a new member of our orthopedic department. As you may know, Jersey City Medical Center is the regional trauma center. And we're very excited to have a new member of our staff join our orthopedic team. And we're going to be right back to talk with Dr. Richard Yoon.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer a Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunnelly Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunnelly Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back. We're here with Dr. Richard Yoon, who is a new member of our orthopedic department at Jersey City Medical Center. Dr. Yoon, welcome. We're so glad to have you with us. You started with us when, in June?
September, actually.
September, oh, okay, right. I remember talking to you back in June, and
yes.
So you just started with our staff. So tell us a little bit about yourself. You're a fellowship-trained orthopedic trauma surgeon, so kind of where are you from, and how did you end up at Jersey City?
Sure. I'm a Jersey boy.
How are you? Okay, great.
Raised up in Bergen County. I went to high school up at the Bergen Academies, the Science Magnet School.
Great.
I went to Trinity College up in Hartford for college. Then I did a 2-year research fellowship at Columbia, where I actually ran their hip and knee center, their research. That's where I really fell in love with orthopedics.
So that was before medical school?
That was before medical school.
Wow, that's great.
Yeah, that's when I really fell in love with orthopedics and realized how hard it was to get into. So I got into medical school. I went to Rutgers, New Jersey Medical School in Newark.
Oh, great. You are a Jersey guy.
I am, through and through. Got to stay close to home. And then I went to NYU Hospital for Joint Diseases for residency.
Okay.
After 5 years there, went to Orlando for a combined trauma and complex adult reconstruction fellowship.
Great.
So I returned home to join one of my best friends, but also one of the best bosses and chairman, Frank Liparachi.
Yeah, we're very excited to have Frank on our staff.
I always joke around with him because I met him in medical school, so it's probably the longest job interview / recruiting process of all time.
So he was a fellow when you were in medical school? Or
he was a young attending. He was probably 3 years in when I first met him. 3 years out of fellowship then.
Right.
And since then, it's been 10 years us working together.
Wow. So I'm intrigued. I didn't know about the work that you did before going to medical school. So you were actually working in a research lab? Looking at joints and knees? Or?
Absolutely. I was coming out of medical school. Coming out of college, I didn't really know if I was ready for medical school yet. This job came up. My boss at the time, Bill McCauley, he was an alumni of Trinity. He gave me a shot to be research coordinator and run his entire clinical lab.
Wow.
There was a 6-month probationary period. I loved it. I guess I did well. He kept me on for 2 years.
Wow.
And we were part of several different studies where I helped run them. One of our main things was a data registry of all outcomes for our joints patients.
So were you actually developing devices, or you were just studying the patients who had replacements?
Right, we were studying the patients that had replacements. Then we're also part of several multi-center national trials. One of the biggest ones was called the FOCUS trial, which is pretty paramount in today's transfusion protocols following not only hip fracture surgery, but joint replacements in general. That was a great experience to be involved with an NIH R01 grant.
Right.
And there were also several other, I guess, post-market IDE studies that I was a part of and helped run to get to track our patients, how they do after both primary and revision joint surgery. And that was when I really got to see how well joints patients do firsthand, and when I fell in love with orthopedics.
Wow, that's great. That's great. It's great that you were able to kind of take it from that research all the way through to your, your goal of being an orthopedic surgeon. So that's great.
Absolutely.
That's really great.
Absolutely.
Well, we're really excited to have you here. One of the things that I was most proud of with when we recruited Frank, Dr. Liberace, to our campus was that he was a fellowship-trained orthopedic trauma surgeon. There's not a whole lot of those, right? And now you are. Not a whole lot of those in the state of New Jersey.
No. Probably maybe a handful or less.
Right.
That do the complex patients who get in car accidents, motorcycle accidents, and unfortunately get hit by cars.
Right. So is that really what that means? That fellowship-trained orthopedic trauma surgeon means that you've done some special work for those kinds of procedures?
Yes. It means that I guess for anyone who comes in unstable, especially from the fracture perspective, which could mean life or death for some patients. These high-energy injuries, they can occur with if they have a pelvic fracture, for example. And if you don't stabilize that properly, they could exsanguinate and die.
Right.
And a lot of these patients come in with multiple extremities injured. So you need to know how to kind of take care of those, fix those, but also work hand in hand with the general surgery trauma team so that you can, maximize their outcomes while minimizing their time in the ICU and any kind of other complications that might happen with very difficult to treat patients.
Sure. And so how long was your fellowship?
A year.
It was a year.
Mm-hmm.
So, and that's really all you focused on were those traumatic injuries?
For an entire year in Orlando, the catchment area there is very, very large.
Pretty
because
large, right?
They
a lot
have
of people from Disney?
Yes, actually.
Really?
You'd be surprised, but they do. That's where they come. But we had 4 or 5 helicopters. My job was to operate every single day.
Right.
So last year, I treated over 1,000 patients, did over 2,000 procedures in just a year.
Wow.
So the volume was incredible. The experience was incredible. And, having that kind of experience coming out and starting practice, it's not much you're afraid of, let's put it that way.
Right. And I mean, look at where we live. The fact that Jersey City is such a densely populated area, all these highways everywhere, and there's always some trauma coming into Jersey City Medical Center.
Absolutely. Can't forget about the gunshot wounds too. So take care of those too.
So we have those also, right?
Yeah.
And lately we've had kids on bicycles. So I mean, it's been really, so we're so happy to have you here to be able to handle those kinds of injuries.
Thank you for having me.
Sure. So you work closely with our trauma team also?
Yes, I think the general surgery trauma team, which is great here at Jersey City in the ICU, it's really a synergistic relationship, and we have to communicate together well, or else our patients, things fall by the wayside. Right. Especially with these critically injured patients.
Yeah, it's always amazing to me that our trauma team works so well with the orthopedic department, and there's really works in concert with pretty much all the surgical specialties at Jersey City.
Absolutely, they're a great team.
Yeah, we always talk about that golden hour for trauma, right? Getting the patient treated. So I guess you've been here a short period of time, but I think we do that pretty well at Jersey City Medical Center.
Yeah, absolutely.
Making sure that we're there to treat the patients and be there on time.
Oh, absolutely, and everyone's from the nursing staff in the trauma bay to the nursing staff in the operating room. If there's an emergency, they're rolling. I don't want to say rolling out the red carpet, but they're clearing the way for us to do what we need to do to stabilize our patients and save a life.
Great. Well, we're going to talk a little bit more about some of the other things you do outside of trauma, working with Dr. Liberace and Dr. Capo. But we're so happy to have you here at Jersey City Medical Center, and we're really excited about all the new things that you could bring to our staff and that we can learn from your experience down in Orlando.
Thanks for having me.
Okay. We'll be right back. We're going to talk more about orthopedic trauma at Jersey City Medical Center.
The Jersey City Medical Center, you know it for its award-winning life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want. Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back. We're here with Dr. Richard Yoon, who is our new fellowship-trained orthopedic trauma surgeon who's joined our orthopedic group at Jersey City Medical Center. One of our key product lines at Jersey City Medical Center is orthopedics, and so we're so excited to have you here and be a member of our orthopedic team. You talked a little bit about your relationship with Frank, that you've worked with him for actually since you were in medical school, you said. So the fact that you followed him all the way through is really great that you're able to work with him here now at Jersey City. But tell us, so in addition to doing orthopedic trauma, you do other things, elective procedures. Tell us a little bit about what some of the things are that you do in orthopedics at Jersey City.
Well, you can almost call it my first love. You know, I remember the first patient I saw when I was like 22 years old doing research, and one of the first patients I saw came back about maybe 6 weeks out from a total hip replacement, and walking into the room with my boss at the time, she looked at him and us and she started sobbing, and he was kind of taken aback. He said, "Mrs. So-and-so, what's going on?" And she looks at him and she goes, "Well, I thought you lied to me when you said I would be able to play with my grandkids again."
Oh, wow.
So that was like the first experience where I had like, okay, wow.
Wow, you really touched somebody.
You really can help someone get their life back in activity. Right. And as I went through my training, I realized physicians are fantastic, and especially our medical colleagues and everyone, they take fantastic care of their patients. But in orthopedics, we truly get a chance to, I think, change someone's life and impact their quality of life so they can get their function back and get back to doing the things they love with their family and their friends and their kids. And that's where I think joint replacement is probably one of the most, especially the hip, probably one of the most successful surgeries, arguably, you know, of all time. Right. The survivorship is great. Patients feel, they often say even in the recovery room how much better they feel, that the dull aching pain in the groin is gone. Right. And you know, they really, some of them really do come back, and they ask you whether or not this pain is going to come back or not. Right. So joint replacements themselves. And so
does it? Does it for many patients? Do they come back, or?
In the hip, most of the time, no. Okay. The knee's a little bit more finicky, but even with the knee, if you pick the right patient and you kind of go through all the non-operative regimen and you wait till they're ready, and truly in its shared decision-making process, knee replacements, they can do fantastic. Patients can get back to skiing, they can get back to the activities.
That's what I want to do, and my knee's hurting. You guys got to help me out here. You know?
You're too young.
I know, I'm too young for a knee replacement, but I want to go skiing again, and the knee's stopping me, so I don't know.
We should come see us.
Oh, yeah, well, I actually have an appointment. I'm coming to see you guys. But these days, like it used to be, somebody came in for a hip replacement, they'd be in the hospital for 2 weeks. And then they go to rehab, but it's all different now, right? I mean, it's...
Absolutely.
We're talking about outpatient sometimes now, right?
Absolutely. So I think not only has the technology advanced where our instrumentation and our implants are allowing us to do the surgeries in smaller incisions, as well as our surgeries last longer. But I think our technical ability, along with our kind of approach to joint replacements, has changed a lot. Gone are the days where patients are being pre-admitted the night before.
Right.
And staying 2 weeks or going even to rehab now.
Right.
Our preferences now are to come, get educated preoperatively,
okay. Right.
about what to expect. I think that's a very important part about hip and knee replacement. So they really have no surprises. They know that they're going to be going home on postoperative day 1 or 2. And even then, we have a protocol where patients are getting medications in holding before the surgery,
right.
During the surgery, even locally in the area where we do the surgery, and then a multimodal pain regimen after the surgery, so that we're really maximizing and maximizing function while minimizing pain and getting patients home sooner.
Right. And so they don't even go to rehab these days, right? They're going right home to with home health.
Yeah, absolutely. They're having PT come to their homes,
right.
To show them a home exercise regimen as well.
Right.
We encourage them to do the exercises on their own, and
right.
so oftentimes with the patients, you have to kind of hold them back. Sometimes they're
really?
feeling so great that you're like, okay, please don't do yoga.
There you go.
This soon.
So all you folks out there who are afraid of hip replacements or knee replacements, you need to see these guys. They're the absolute best, and you guys do a great job. So you do an anterior approach.
It depends on the patient.
Okay. So tell us what that means. I'm using big words here for our friends at home.
The studies have shown that there really is no difference between an anterior approach or
meaning you're laying on your back and
correct,
right? Okay.
Or a posterior approach where you're kind of up on your side.
Okay.
However, for the younger kind of more fit patient, especially young men. I'll offer anterior approach. It's a little more muscle sparing. You have a lower dislocation risk, and really they can get back to function very, very quickly.
Right.
However, if for the older patients or for our more obese patients, going anterior actually is a little more dangerous because you have an increased risk of infection.
Okay.
So for those kind of patients, you do want to do a posterior approach,
right.
Just to make sure that you avoid those complications.
Right. They talk about doing hip replacement surgery on an outpatient basis. What do you think? Are we ready for that yet?
I think we are. I mean, it's definitely doable, especially with the pathway and the system that we have in place. You have to pick the right patient, the
right.
motivated young patient who knows, what the pain threshold is going to be, and what they want to do with therapy, and
right.
they have to be very motivated. But it's definitely here, and it's definitely possible.
Right.
And I think we have to, with the right patient, they'll do great.
Right. Now, our inpatient orthopedic unit is kind of a special unit designed really for orthopedics. We have our gym right across the hall. So I mean, we get patients out of bed, right, the same day or the next day?
Same day in the afternoon for our AM total joints.
Right.
Twice a day after that. And really, they're
How long are they in the hospital?
For total hips right now, probably, I think our average is about 1.5 days. Total
wow.
knees, a little over 2 days, a little
right.
less. So they're up, they're moving, and like I said, they're going home. They're not going to rehab.
Right. And then we have physical therapy right on the floor, so they're able to assist them right across the hall from where they are.
Absolutely. And not only that, I think our floor is great because we have nurses who are trained specifically in orthopedics, so right. they know what to look for and things like that. Our social workers are also very aware of what our patients' needs are on an outpatient basis, and also our therapists are specifically orthopedically trained specialists who can get them out of bed.
So it's interesting. We're talking to our chief nursing officer, and we have a really high skill mix when it comes to our nurses. But we didn't really talk about the certifications. So there's a specific orthopedic certification for our nurses and for our physical therapists.
Yes.
And the majority of our nurses on that floor have that certification.
Absolutely. And you can tell right away. When they're coming off a medicine floor or something like that and coming to our floor, that's where, even if they're admitted under another service,
right.
if the primary problem is orthopedic, we prefer them on our floor because our nurses can take care of them.
Right. That's great. Well, we'll be right back talking more about orthopedics at Jersey City Medical Center.
Rama Jewelers, located in the Lyndhurst Shopping Center at 413 Valley Brook Avenue, Lyndhurst. Come for all your jeweler needs at Rama Jewelers, where you will find a fine selection of necklaces, earrings, rings, and bracelets. Choose from one of our complete sets, our many signature items, or find the perfect engagement ring. Come on down. That's Rama Jewelers at 413 Valley Brook Ave, Lyndhurst. Call 201-939-5784 or visit us online today.
You know those times when you need to see the doctor, but you just can't get to the doctor? So where do you go? Go to the App Store, download the Telemed app from RWJ Barnabas Health, and you see the doctor right away. From any mobile device, whenever you want, wherever you are.
Quality care, no appointment necessary. The doctor is online when you download the Telemed app.
Don't you feel better already?
RWJ Barnabas Health. Let's be healthy together.
And we're back with Dr. Richard Yoon, who is a new fellowship-trained orthopedic trauma surgeon at Jersey City Medical Center. Dr. Yoon, we're so excited to have you on our staff. So, a couple things. You are right on our campus, right, at Jersey City Medical Center, right in our medical office building? That's
Yes,
where your
sir.
office is.
Right across the parking lot. So
Right across the parking lot.
Very close.
So if somebody needs to come to see you, they know it's right there at the medical center. It's very convenient for you.
Absolutely.
There. We have general radiology in that building also, so if they need an x-ray, they can get their x-ray there. It's all very convenient.
Very convenient, yeah.
So the other thing is we've got an orthopedic institute at the hospital, newly renovated, all private rooms. Patient feedback on our rooms?
They love the privacy.
Do they?
They love the view.
Right.
The view of the river is
right.
fantastic.
Yeah, that's right. They have a view of the Statue of Liberty too, right?
Absolutely.
Yeah,
so
that's great.
Combine that with our orthopedic nurses and therapists and the gym right across there.
Yeah.
The private rooms are definitely a huge hit.
Yeah, it's like you're not even going for surgery, right?
Exactly.
It's like a little vacation.
Exactly.
But seriously, before you send a patient to for their hip replacement or their knee replacement, a lot of times you'll send them to rehab, right? To tune them up, make sure that they're ready for their surgery.
Yes.
Tell us, what does that do for the patient?
Well, it does a couple things. One, it educates them on what to expect after surgery, but also gets them in the mindset that they do have to kind of get their muscles stronger even beforehand in order to make their post-operative course easier.
Right.
So we write specific prescriptions to our therapists that really focus on the important muscles strengthening around the joint without necessarily hurting the patient, because you have to be very careful. If someone has very bad arthritis to their knee, you don't want a therapist trying to get range of motion back if there isn't much there.
Right.
But if you have a therapist teaching them how to get their quadriceps stronger with straight leg raises, and really teaching them on how to do the exercises after surgery, that we've seen that our patients who've had that course before, they really have a easier time after surgery.
They do.
Especially knee replacements.
Right. And do you do that like a couple weeks before, or how long before the surgery do you normally start that kind of process?
We like to have it within, at least within a month before the surgery.
Right.
So it's still fresh in their mind.
Right. And we do that on campus also.
Yes.
With our physical therapy department.
Yes, we do.
It's great. So as a fellowship-trained orthopedic trauma surgeon, one of the things I know that you do are revisions. Tell everybody what that means.
So revisions in terms of fractures that don't heal, also joint replacements that have either been in place for a very long time and kind of mechanical failures. Like, I guess the best analogy really is when your tires need to swap, or God forbid if your joint replacement gets infected, or if there's a fracture around it.
Right.
The complex scenarios.
So
that can
those are
occur.
complications of surgery sometimes,
Yes,
right?
yes. So unfortunately, those do happen, and our center has been a big referral base for outside orthopedists and I guess surgeons who are less experienced in the complexity of those surgeries, where we get to take care of those patients and really treat them with very severe diagnoses. A lot of them have bone loss. A lot of them have mechanical components that have failed with or without an infection, and it's something that we're very experienced with and adept at doing.
So you're not only doing the routine knee and hip replacement, not that that's routine unless, if you're the patient, it's not routine, but you're doing those more complicated cases that may not have gone right the first time or got infected or something else happened. They actually send them throughout the state to you and to Dr. Liberace to see if you can fix whatever might have happened.
Yeah, I mean, we're very grateful for referrals.
Right.
They call us an odd bunch because we enjoy taking care of these patients. But you know, everyone needs help, even these patients, and we're more than happy to help them. And
yeah, I know we've had patients even from New York who end up, not being able to be taken care of there, and they send them over to Jersey City. So I think you guys do something very, very specific, and I think it's an indication of a much higher level of orthopedic care than anywhere else in New Jersey.
We think so. We try. Frank and I have a joke. We barely sleep at night because we worry so much. But it's funny. The harder the case, the more complex the case, the more excited we get about treating it.
Right.
He actually had a transfer this weekend come in all the way up from Orange County, New York.
Wow.
So our catchment area for referrals are not only New Jersey, South Jersey, North Jersey, but oftentimes Pennsylvania, upstate New York, and Manhattan and Long Island.
Right.
So they come from all over, but we're here to help everybody.
Well, so you do prehab, you do a joint camp, you educate our patients all about that. When they come to the hospital, we have the right anesthesia to take care of them, so we minimize their pain. We have private rooms overlooking the Statue of Liberty. It's like a commercial, right?
It's a pretty nice setup.
We have physical therapy, and then afterwards we were able to take care of them in their own homes. So they don't even have to go to a rehab afterwards.
Absolutely.
So it looks like we've got the full continuum of care for those orthopedic patients.
Absolutely.
Sure.
That's how you have people smile all the time when they come back and see you right away.
Yeah. So were you expecting that when you came to Jersey City? Did you know how comprehensive a program that we had?
Well, having known Frank for 10 years,
you know what he would demand, right?
Well, I also rotated here as a chief resident.
Oh, okay, that's right.
So we had a special selective where you could do a month 2 months actually with Dr. Liberace, and firsthand, it was right after the operating rooms were renovated, which are fantastic. Thank you for that.
Sure.
And the floor was renovated, and firsthand, you got to see kind of how comprehensive and how awesome the program was.
Right.
So coming back here was really a no-brainer. I'm just glad you guys took me.
Great. You're right. So a couple of other things we didn't include in that whole scenario are orthopedic certified nurses and physical therapists. I think that's really an important part. Having that certification and knowing specifically how to take care of orthopedic patients, especially post-op, is a big deal. And not all hospitals have that level of certification.
No.
And then you're right. We actually specifically renovated one of the operating rooms. We combined 2 operating rooms that were smaller into one big one so that we would be able to do these more complex cases and have the room for you guys to be able to do what you need to do.
Absolutely. And you mentioned the anesthesiologist, and I can't give enough credit to the operating room staff as well.
Right.
There are orthopedic-specific scrub techs and nurses that make our cases more and more efficient and go seamless.
Right. Well, Dr. Richard Yoon, thank you so much for being here with us. We're very excited to have you as a member of our team. When you need orthopedic care, Jersey City Medical Center is the best. You heard from Dr. Yoon about the comprehensive program we have. We have the right operating rooms. We have certified nurses, physical therapists. Our physicians are fellowship-trained orthopedic trauma surgeons. We have specialties in not only joint replacement, but also trauma, as well as hand, with Dr. Capo. So we really have the full gamut and are the regional referral center for trauma. And we're very excited to have folks of your caliber join the medical staff at Jersey City Medical Center and create this really great program. And don't forget, he's right in the medical office building on our campus at Jersey City Medical Center. Thank you, Dr. Yoon, for being here, and we will see you next time.